received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born again child of the Most High King.
I'm your host, Wendy Bridgers, and we are live in the studio today on Awesome Radio 106.9 FM. I invite you to join us every Thursday from 3 to 3:30 on Family Health Matters. We are on the Awesome Radio Facebook page, um, GPAT Facebook page, and YouTube Facebook page. We are just all over the place. And we're so glad that you're joining us today. And in the studio with me, well, she's home, and I'm in the studio. I have with me Mrs. Maya Pittman, one of my favorite counselors. Hey, yay! She has agreed to be with me every third Thursday of the month. So I'm so excited to have her here with us today. So we're gonna dive right in because we're gonna be talking about understanding anxiety. So
Yes.
welcome, Maya. How are you doing?
I'm doing great. Thank you for having me again.
Oh, you're welcome. Thank you for taking time out of your busy schedule to be with us. I know you just do. Before we get started, just tell a little bit about what you do.
Okay. Well, again, Maya Pittman, I'm a licensed clinical mental health clinician. And so I own my own private practice called Amethyst Counseling Services, where I serve individuals in the area of mental health counseling, overall wellness. I treat everything from anxiety to depression, everyday presenting problems and living stress. And I absolutely love what I do, including public speaking and just being able to engage in outreach and getting information to our community about mental health.
Well, great, great, great. And that's why you're here on our program. And I appreciate you being here. And again, I know you're a busy lady, you got that new baby and a wonderful husband. And I know, but I do appreciate you taking time to share your wisdom, your experience, and your professionalism with us. So thank you again for being here.
Absolutely. Thank you for having me.
You're welcome. You're welcome. So let's talk about anxiety. I know there is a lot of things going on with COVID, with just with the world in general, not just because of COVID, but just things in general. And people go back and forth between being stressed, being having anxiety, being rude, being ugly, being nice, being happy. And sometimes I think people just don't know what they're
Yeah.
doing or why they're doing some things. So hopefully we can enlighten our audience in a little bit about that. So we want to talk about just understanding stress. And I know anxiety in understanding anxiety, because one of the things we want to talk about today is the difference between anxiety and stress. So
Yes.
with that, I'm going to let you lead in and talk about what anxiety is, or do you want to talk a little bit about what stress is so we can do the difference between stress and anxiety?
Absolutely. And I think you're hitting the nail on the head because societally, we often join stress and anxiety, right? We're having a difficult day and we'll say, oh, I'm stressed, I'm anxious. But the two are very different. And it's important for us to distinguish that. So when we think about stress, really the hot button word, really probably the first word that comes to mind when we think of mental health, stress is more so the feeling of being overwhelmed and unable to cope. And this is unable to cope with what one may deem as a normal pressure in life, right? I'm unable to cope with my schedule being thrown off for the day. I'm unable to cope with figuring out what I'm going to eat for lunch. And so the feeling of being overwhelmed or unable to cope would be how we would define stress. Now, anxiety, on the other hand, is rooted in two things that you already mentioned, which is fear and worry. So
Mm.
anxiety is actually the very intense and excessive, persistent and ongoing worry and fear about everyday situations. And so, whereas you may see stressed about things that are very appropriate, anxiety can also show up in very normal everyday situations. So, consider having to speak in public or meet someone new, taking a test, even for the ECU students out there and other college students. Anxiety can be very normal, but it's when those feelings become overwhelming to the point that they interfere with daily living. So let's say you're fearing that test, but now you can't even walk in the room and take it.
Mm.
Or you have to meet a new person, but at the end, when it's all said and done, you decide, hey, something came up, I can't do this. that's where anxiety shows up. So those are the differences between stress and anxiety.
Okay, that's good because so I've always heard a little bit of stress is good for you because it sort of gives you that added oomph. But with anxiety, it can also cause you to be at a point that you just won't do.
Absolutely. It could be at the point that you just won't do. And one of the things we want to consider as a community and family when we think about mental health issues is they lie on a spectrum. So we can have very mild mental health concerns. So again, worry about everyday situations, and it can go all the way down the spectrum to severe, which prohibits us maybe from even getting out of the bed or walking out of the house.
Mm. So that would be considered worry and anxiety can sort of go hand in hand together. Okay.
Absolutely.
Okay.
Absolutely. So when you think anxiety, think fear and think worry. And when you think stress, think overwhelmed and inability to cope.
Okay. Okay. So with the fear, so how would you put that in perspective with anxiety? Is it something that you're afraid of? Because you think about fear, you think, this bear is gonna come get you. Okay, or eat you. That to me is fear, or I'm scared of going outside in the dark. So that's not necessarily anxiety.
Well, you bring up a good point. One of the things about anxiety, especially when you think about from a psychological perspective, anxiety and dealing with anxiety can quickly turn into what we call an anxiety disorder. And one of the anxiety disorders that people deal with are phobias. So, being
Mhm.
afraid of snakes, being afraid of the
Oh,
dark to a level where it really interferes with your ability to move forward. And so, an example of an anxiety disorder is agoraphobia. And this is a type of anxiety disorder in which you fear or avoid all places or situations that may cause you to get overwhelmed. And this is when people may not leave the house. It causes them to feel helpless, to feel trapped, to feel very embarrassed. And so they stay in one place where they feel like they will be safe. That is an intense phobia, and it could be considered, or it is an anxiety disorder, for example.
oh wow. So no, what is that called again? Say it again.
It's called agoraphobia.
Oh, okay, agoraphobia. So
Yes.
that's real. So that is so somebody who does is afraid. So okay, so they're afraid to go out of the house to leave the house. Now, could that be related to COVID? Is that can have you seen or have you heard about people who've gotten so obsessed with the pandemic until they've gotten to the point that they won't leave their house because they're afraid? So is that type of anxiety disorder?
Absolutely. That would be the type of anxiety disorder. And I got to call you out because here on Family First, I know we talk about language. And so I know you use that word obsessed, right? And I think obsessed can come with somewhat of a negative connotation. And so if I could, so respectfully, change that word obsessed to overwhelmed. So we can get
Okay.
overwhelmed in thinking about what we may run into because of COVID, right? We may get overwhelmed in thinking about how many people we would be exposed to if we walk out of our house, or how many hands we might feel like we have to shake when we walk outside of our homes. And so think about a snowballing of thought. If I step outside of my house, I may run into someone. That person may have COVID. That person may have met someone else that has COVID. Then I'll get it. Then I'll bring it back to my family. And it can become very, very excessive.
Okay. Well, girl, I saw you get up on the edge of your chair. I was like, "Oh, whoa, she's coming after me, but she can't get through this screen." But that's good. That's good because that is bringing aware, and that's a good thing. And so, overly obsessed. What was you told I should use instead?
Overwhelmed in thought.
Overwhelmed, becoming overwhelmed with
Yes.
something. Okay, all right, okay. Because that is so true. And I've heard people talk about that, not wanting to leave the house because
Yes.
they are afraid that if they go out, then but how do you help people?
Well, it's very difficult because we can't predict when one will have an anxiety disorder. And so
Mhm.
there are risk factors that we can consider. One of them can be genetic. So it's very important. Again, we always talk on Family First about having conversations with our family. Well, what
Right.
was it like for you growing up? What kinds of things did you experience? So that's one of the risk factors that we want to think about. Another risk factor could be trauma. So let's say you did go outside of the house and something terrible did happen. That can cause a trauma that sticks with you. And causes you to develop an anxiety disorder. And those are some of those examples. So with lifestyle changes, we want to think about ways that we can reduce the buildup of stress. And we want to also think about ways in which we may have to change things like drug and alcohol use, which can absolutely increase our experience with anxiety, and even eating, for example. So if we find ourselves eating unhealthy for long periods of time, that affects the body and in turn affects how we deal with stress, thus can lead to anxiety. And so there are other things like staying active, for example, again, staying clear of drugs and alcohol. A big one is limiting caffeine intake. If you think about how caffeine can impact the body and raise the heart rate, that is an example of how it can lead to some feelings of chronic anxiety. And of course, from a professional standpoint, talk therapy is absolutely at the top of the list. And this is being able to get outside of your head those excessive and overwhelming thoughts that maybe run through on a daily basis.
Wow. And you're talking, the first thing popped in my mind was February is Heart Health Month.
Yes.
And you just walked right all through that as far as making sure. So I just want to put that out there, everybody focus on heart health during February. And you think about mental health and you think about how, what does that have to do with the heart health? But you just hit the nail right on the head when you talked about the anxiety, which can lead to the irregular heartbeat, increased heart rate, possibility of having hypertension. So all of those things flow with the part of the anxiety relating to heart health. So that was great. So we got that plug in there about that as far as managing that anxiety to help offset some of the chronic or medical conditions that can come along with it. Exactly. Good.
Absolutely. And if I could jump in here, there are two more anxiety disorders that I want to point out that relate to just what you were talking about as in terms of it being American Heart Month. And that's anxiety disorder due to a medical condition. That is an actual disorder, and it includes intense symptoms or anxiety or panic that's directly caused by a physical health problem. So if you can consider what it feels like to be dealing with some sort of medical concern, that can create a lot of fear and a lot of worry and thus lead to an anxiety disorder. And then the other one is panic disorder. Now, this is one that we often also call having an anxiety attack or a panic attack. And this revolves the repeated episodes of sudden feelings of really, really intense anxiety. And that's where the heart comes in. So there is a condition called tachycardia. It's called tachycardia. And this is a direct effect of anxiety on the heart. So in serious cases, this is really just increased heart rate over an extended period of time due to anxiety, and it can ultimately lead to heart failure.
So people can actually have that as a medical diagnosis?
Absolutely. It can be a medical diagnosis. And I will say, when I first started in mental health counseling, a lot of the referrals I received came directly from their primary care doctor. So they were experiencing increased heart rate or they were experiencing chronic headaches and didn't know what was going on. And it turns out they were dealing with chronic stress or chronic anxiety.
Okay. So that was the underlying cause
Absolutely.
for the symptoms that they were portraying.
Yes.
Oh, wow. So that's good. That's good. So that all interchanges your mental health, interchanges with your physical health, day and night, work hand in hand together.
Absolutely.
Wow. So tell us some more about the different disorders. You mentioned the panic disorder.
Yes.
And then you talked about the medical conditions related to anxiety.
Absolutely.
Okay, so what generalized anxiety disorders?
Yeah, so this is a big one. I think this is the one that many Americans experience. We call it GAD or generalized anxiety disorder. And this is persistent, excessive anxiety or worry about activities and events. So even ordinary, everyday routine. The interesting thing about GAD or generalized anxiety disorder, it is literally what the name says, having general anxiety about general everyday experiences. Now, what's notable about general anxiety disorder is the experience of stress and anxiety doesn't match the situation. So a great example of that is, let's say you're walking down the street and there is a turn you usually make and it is blocked off. And instead of just saying, hey, you know what, I'll go another route or I'll take a detour, it stops you in your tracks. Your heart starts beating fast, your hands start trembling, and you're literally stopped in your tracks due to the excessive worry about not being able to do what you've always done. This is an example of generalized anxiety disorder. Anxiety that doesn't match the stressor.
Okay, so who determines that it doesn't match the stressor? I mean, how does that work? Suppose that is important to me, that
Mhm.
I can't go my same route that I normally walk. So is that something that's diagnosed by somebody else, or
Yes,
okay?
absolutely. So again, right, we wanted to point out the fact that we have a little bit of stress and we have a little bit of anxiety, but where it becomes an issue is when it interferes with daily living.
Ah,
So you bring into question the signs and the symptoms. This is a feeling of nervousness, feeling restless or really tense in your body. So your muscles literally kind of lock up. Having an impending sense of doom, breathing rapidly, sweating, even having trembles, feeling weak, almost as if you're going to faint. These are things that will very much interfere with our ability to move forward, to do the everyday things that we need to do. Now, if you just have a regular, or what we would say normal, experience with anxiety and stress, you would be able to note the stressor and say, you know what, this is an inconvenience, but I'll just move forward anyway. It's
okay.
irritating me, but hey, I'll just get through it. Whereas if it's generalized anxiety, or anxiety is there, I'm not going to be able to move forward, or it will be extremely difficult and take some time for me to do that.
Oh, wow. So how do we as the family help when that's identified? How do we help a person, a family member that is at that point, that when they see the obstruction, that the example that you gave, how do I help them get through that? Is there a way that we as family members can help support them in that area?
Absolutely. So I think one of the biggest things is to listen and observe. I know I say that all the time, but I'll use the example of separation anxiety disorder. And this is a childhood disorder. So when we think
Mhm.
about our families, a lot of times children may have a really difficult time separating from their parents, separating from their family. They may develop anxiety about that. You'll see the tears. They may have a temper tantrum. And historically, generationally, especially in people of color, we've dismissed that. Children aren't given a voice. And so we'll say, hey, get over it. Oh, they're overreacting. Calm down. Stop crying. As opposed to stopping and saying, hey, what are you feeling? What's
Mm,
going on?
that's
What are you
true.
thinking about? Is
Yeah.
something scaring you? And I think that will give us insight into what someone could be dealing with. I think the other thing is if we see something persistent. So again, one of the ways in which we assess anxiety being there is if it's excessive and if it's persistent in nature. So if I recognize that a child, or I recognize that a family member is being, again, stopped in their tracks more often than not, that may be something that I have to look into. And so I'm only going to do that by observing them. And I'm only going to get insight into what they're experiencing mentally and physically by listening to them.
Okay, wow. That's good, because you just make me think in my brain, and I hope the audience is the audience is thinking the same thing, because I can remember so clearly and so often when you talk about separation anxiety with children, and parents leave to go somewhere, and you have to, and
Yeah.
children have different emotions, they cry, but how often do you just you go, but how often do you come back and ask them, tell me what you were feeling. And
Right.
because you're right, because we don't talk about that. We just chuck it up to, you go, you'll be okay, you'll be okay. But how do we get and I know this probably is a little bit off, but how do we change our mindset to think that way? And because if it's always been in you, and you said, and I'm not trying to stereotype or anything of people of
Oh,
color,
yeah.
but sometimes we're so in tune and so busy going and doing until we don't stop and think, well, let's talk about this.
Absolutely. So this is where we have to allow ourselves to check ourselves. And so one of the things that I often do with clients that I work with is we do a self-assessment. And a part of knowing self is doing an evaluation. How do you respond in certain situations? What do you know as your strengths? What do you know as your weaknesses? And what those types of questions do is it allows someone to slow down and evaluate how they respond, what their behavioral patterns are, what their belief systems are that may need to be revisited. And then it can really point out some of the ways in which we're damaging to ourselves or damaging to others. And so I think it's important for us to all have a moment where we just take a self-assessment. A great tool to do that is called tracking, that anyone can do. And tracking is, let's say, you know what, I'm going to take 2 days or I'm going to take a week, and I'm just going to be a master observer of myself. I'm going to write down and note the times I've become extra irritated or become upset. Maybe sadness has crept in. I'm going to take note of the times where maybe I feel excessively joyful or happy. And then when you look back at that list, you'd be surprised at what you find out or recognize about yourself that you didn't stop to ever think about. And this is how we can realize where the changes need to be made and how we interact with other people. Maybe some of the belief systems that we've held for so long, and now in seeing the findings of that assessment, we recognize could stand to be changed or addressed. And so we've all got to kind of have a what they say, come to Jesus with ourselves every once in a while to make sure we're in line.
That's very good, because how often we do that? We are so quick to look at everybody else, and we're so quick to observe everybody else and check everybody else. But how often we do a come to Jesus meeting with our own selves, where it could be, and we pray, Lord, fix them, but it may be fix me or help me to see myself.
Yes.
I think that would be will help a lot of things that goes on in our lives, is that we step back and maybe look at the situation that's going on and what is the cause of the situation. And we always do that in the medical field and nursing, because we always teach, or even with our students, we always tell them, what skills that they need to learn how to perform. But then we go back and say, well, you need to know why you are doing these things.
Exactly.
Turning it around mentally is, if you observe something, then go back and look at, well, why is that happening?
Absolutely. And as you say that, I think you bring out the important entity of time. So another way to treat anxiety is in a practice called mindfulness. And I know that's become quite a buzzword, but if we just reduce it to simplest forms, mindfulness is synonymous with awareness. And awareness requires patience. It requires time. And what awareness does is it allows us a moment to think about what we're feeling, think about what we're thinking, and bring in the truth, so to speak, so that we can kind of challenge and focus and level off some of those excessive thoughts and some of those excessive patterns of thinking maybe that we get overwhelmed by.
Good. That's good. So setting some time for yourself and your family can help with that anxiety.
Absolutely. And being present. There's a wonderful book that I would recommend to families. And it's about mindful parenting. It's called Everyday Blessings. And it's by a man called, his name is John Kabat-Zinn. I know that sounds crazy, but Everyday Blessings. And it's a beautiful book because it really just talks about how we can be in moment and how much of a difference that'll make in our parenting and how we relate to our other family members, instead of always thinking about what's to come in the future or ruminating or thinking regretfully about the past. What does it mean to be very present with one another, to be in the moment, and to appreciate the moment that we're given? We're actually able to see things in a much greater light, with much greater accuracy, and it helps us bring down stress and anxiety that we may feel.
And I can understand that. I really could. Just on a day, just like today, I don't think had anxiety. I don't think, to the point that I couldn't function, but just the process of the day, of the things that I had on my to-do list, and trying to figure out how to figure them all in to be able to get them accomplished, was causing some stress and anxiety, to the point that I'm just like, wow, can I get all of this in?
Yeah.
But I think I like that part about what you're saying, maybe stepping away and just having an opportunity to just sort of think about the whole process.
Absolutely. Taking a moment to just take a breath.
Yeah,
You
yeah,
know, and
yeah,
appreciate that moment.
yeah.
Absolutely.
And one thing I've learned just for myself is that, and I guess this is the medical part of me, that if it's not going to kill anybody, that sometimes it's okay to just sort of let it wait. It's not gonna, you're not gonna hurt anybody.
Yeah.
If it doesn't get done, it's important, and I'm not saying it's not important, but what would be the outcome if it didn't happen? What would be the outcome? And if you think about that, to me, that has helped me prioritize some things as far as what's important and what I can sort of wait on and not procrastinate now. But
Right.
you know,
Yeah, absolutely. The mind, and I always remember this, is a masterful storyteller. And so, again, when we think about the worry and we think about the fear that is involved in anxiety, the worry and the fear comes from what our mind kind of conjures up to be true, not what actually is true. And so, I kind of, as you say, those moments allow us to see what's real and what our mind is telling us is real.
yeah, and we can think on something, and when you said conjure up, and you just think and think and you think about it, the more you think about it, the more nervous you get about it, to the point that you are having an anxiety. And I do believe sometimes, and you tell me if I'm wrong, that you can work yourself up to having an anxiety attack.
Yes, absolutely. One of the risk factors for anxiety and anxiety disorders is the buildup of stress. So
Mm,
absolutely, you're absolutely right. Work ourselves up to a point of anxiety.
yeah, yeah. So now, what do we do about it? What we're running now. So it's been great,
Yes.
and we're right at almost about a 2 minute mark. So,
Yeah.
well, 1 minute mark. So, what really quickly, what can we do about it?
So really quickly, symptoms can be reduced by one, getting help early, right? So even if you're unsure and you have a question is enough to get answers. And so that's an opportunity to go in and ask maybe primary care or do a quick quiz, Google anxiety symptoms. Another
Mhm.
way, again, is those lifestyle changes. So prioritizing getting healthy eating and a good night's rest. Again, anxiety is rooted a lot of the time in biological and physiological functioning. And so our body may create anxiety before our mind does. And so it's important to eat balanced, to practice mindfulness, allow ourselves deep breaths and good fresh air every now and again, steer clear of drugs and other alcohol, as that can heighten and increase some of those experiences. And again, staying active. So going back to that mind body connection, one last thing that I would consider doing is journaling. What journaling
Mhm.
does is it gets the worryful and stressful thoughts out of our head and on paper and sort of clears the space, so to speak, to reduce that buildup of stress that often causes anxiety. And so those are just a few things that we can do, right? We don't need to pay for it. It's right at the tip of our tongue, at the edge of our seat. We can gain access to that.
Awesome. Wow, girl, this has been so good. This has been good for me. I'm getting my free mental counseling session.
That's great.
Thank you, Maya. Goodness, time has ran out. I do want you to send me the name of that book, though.
I will.
You
I
send it
absolutely
to me
will.
when you get a chance. But
Okay.
do want to thank you for being here. As always, you're just awesome with the amount of information you shared. And just to close out, I'm your host, Wendy Bridgers. We're here on Awesome Radio 106.9 FM every Thursday and Friday, every Thursday from 3 to 3:30 on Family Health Matters. And again, thank you, Maya, so much for being here with us today. As always, great information. And look forward to seeing everybody next Thursday at 3 o'clock on
This
Family
is
Health Matters.
Awesome Radio, WBISLP
All
106.9.
right. Good job.
Partial funding for this program is brought to you by C.